Hi, welcome back to Rohrich Knose podcast, helping you become a better and more informed you. Let's talk about rhinoplasty and the recent buzzword of preservation rhinoplasty or precision rhinoplasty. And really, today, let's talk about the hybrid portion of that and how you blend these two important concepts together. And, you know, the most important thing about a rhinoplasty is, first of all, it's the hardest operation we do in all of plastic surgery. But how do you get consistent and reproducible results? And you have to use structural rhinoplasty principles. And they have to be versatile and reproducible. And so when you see patients, you know, how do you get consistent results in both primary and secondary rhinoplasty, as you can see in these patients here? You know, these are very challenging things. But the last several years, we've talked a lot about preservation rhinoplasty. And what does that mean? It really means you're trying to preserve the top of the nose to the best of your ability without undermining the skin or even undermining it, but keeping this area intact, the keystone area. But preservation rhinoplasty is a little bit of a misnomer because it's really a more complicated procedure because you're really stabilizing or destabilizing the septum, and it's much more complicated than what people think. So you really need to know before you go, and it's not a simple operation because it has some risks and complications that are unique to them, especially the saddle and recurrent hump. And we don't know a lot of these long-term sequelae, so you have to really know it. And I always remind the patient, and even my colleagues when I talk about it, is that, remember, through every technique we go through the zealot phase where everybody's using it, and then all of a sudden we get to the reality phase, which is where I think preservation rhinoplasty is. And what is it? It's a technique that's used in refining results, and that's really what it is. But to become an expert, you have to really understand structural rhinoplasty, no matter what. So, how do I select patients for preservation rhinoplasty? I choose the right patients, and I know what works and what doesn't work. And one of those most important things is the blocking points, which really, if you understand the blocking points in preservation rhinoplasty, that'll help you prevent recurrence. So what are my most 5 favorable indications? And that's really, do they have good dorsal aesthetic lines like this patient? And do they have not a significant dorsum, but a V-shaped dorsum and a strong septum and not very deviated? Those things are very important. And this is graph that shows the favorable indications, which are, you know, a V-shaped dorsum, a radix that's maybe high, a short nasal bone, and a straight, reasonable dorsal aesthetic line. These are all things that make it very, very favorable. And then the blocking points, and this gets a little technical, but basically it's an article I wrote in the Journal of Plastic and Reconstructive Surgery with one of my great colleagues, Dr. Gotzel from Turkey, and basically it's really the areas that you should release so you don't get a recurrent problem. And these are written in a journal article that I wrote recently with Dr. Gotzel, and really there's 8 of them, and you need to really understand every one of them anatomically if you're going to understand how to do preservation rhinoplasty. And this is a great case to do that in a patient that had a straight nose, nice thin skin, dorsal aesthetic lines, short nasal bones, beautiful young woman, and we just did a high septal strip, did a push-down technique, and she's beautiful at a year. She's got beautiful dorsal aesthetic lines. The tip looks beautiful and natural. So these are the types of patients that look excellent for preservation rhinoplasty because they look good early on and they look like this for a long time, and that's what you want, a natural, beautiful looking nose. And so that's what was in this. And another example is a patient like this that's got thin skin, slight dorsal deviation, a good normal radix, and she looks amazing. I did a high septal strip, preserved the dorsum, did a push-down technique, and then here she is at 2 years post-op, and you can see she looks like she did it 3 and 6 months. And you can see how amazing she looks with her dorsum looking beautiful and straight. Her tip shape is great. You can see when she animates, it looks good. It looks fantastic. And you can see when you look at the profile, it also looks unbelievable. And that's the sign of a good rhinoplasty. So when you see this, that's when you know you've had a great result. So here she is at 6 months, 2 years, 6 months, 2 years, she looks great and natural. And that's really what you want. It's a sustainable procedure. And over, 6 months, 2 years, 6 months in her side view, 2 years, and on, and it looks the same, which really goes a long way. So this is a very good technique. Now, does it differ from an open structural rhinoplasty? We took a deep dive and looked at this with some of my fellows, and what we found was that there was no difference in looking at the outcomes at 2 months or 1 year, because people couldn't tell whether they had precision, which is a structural rhinoplasty, or a preservation rhinoplasty, and both the results looked good. They looked really good. So no one could tell using these 5 favorable indications. And the key is select your patients well. Use good surgical judgment. And the most important thing is finding a rhinoplasty surgeon that is very facile in rhinoplasty, both preservation and structural rhinoplasty, and then you'll get good results. So know before you go, choose a board-certified plastic surgeon or facial plastic surgeon who's got expertise in rhinoplasty, because rhinoplasty is still the most challenging procedure in all of plastic surgery. So know before you go, and hopefully this helped you understand the concept of preservation or precision structural rhinoplasty, and that both give good results. But know your surgeon and make sure they select you to be that patient that gets the best result with the best technique. Give me your thoughts, give me your comments, and until next time, stay safe.